Welcome. I'm Daniel Minty, a cognitive behavioral therapist, teacher, and writer. I'm joined this week by Eric Leskowitz, MD. Dr. Leskowitz has an appointment at Harvard Medical School's Osher Research Institute, and he founded the Integrative Medicine Project in the Pain Management Program at Boston's Spaulding Rehabilitation Hospital. He's edited 3 textbooks and published more than 50 papers in the peer-reviewed journals. His new book, The Mystery of Life Energy, has garnered enthusiastic acclaim from every corner of the research community. Ken Wilber calls it a massively and extraordinarily important book. In this conversation, Dr. Leskowitz describes his treatment of a patient's phantom limb pain and the deep lessons about healing this patient taught him in the process. Please join us. Good morning and welcome to the program. Delighted to have you with us here this morning. Well, we could start with a question that I think that you're uniquely qualified to answer, which is, what is energy medicine?
Well, first off, let me start by thanking you for inviting me to be on your program here. I appreciate the opportunity to talk about something that I really love to talk about. So you'll have to cut me off when I go over the time limit. No, that's a really important question. What is energy medicine? Um, it's new and old, a combination that I think has the potential to transform how Western medicine, conventional medicine, is practiced. I did train in medical school, and the medical model, if you will, the way of thinking about health and illness is very mechanically oriented, that the human body is a complicated machine. For example, the heart is a pump, and the eye is a camera, and the brain is a computer. Those are very compelling metaphors, but they leave out some very important stuff, namely what is it that coordinates and helps everything to stay in a state of health or balance. And it's interesting because Western medicine is the only form of healing around the world that doesn't include this notion of energy, whether it's called life energy or vital force. People are very familiar nowadays with some of the Eastern approaches, like in the acupuncture view, there's an invisible energy called chi. In the yoga model, there's the same invisible energy called prana. Indigenous peoples around the world, it's like everywhere but us. So that could mean one of two things. One is that we're the only ones who have the true understanding and everybody else is primitive and missing the boat, or we have so narrowed our focus that we're missing the forest for the trees, literally. So that's the energy piece, and it's gradually become integrated into Western medicine. I've seen a lot of changes over the 50 years or so since I started I started medical school, yikes, 50 years ago. Um, and a lot has changed since then. And I think a key component of it is bringing energy-based therapies into the under the umbrella. And it started out with things like acupuncture, which conventional doctors can come up with a sort of a mechanical or mechanistic explanation that, the needle presses on the skin and it causes some shifts in the electrical field and the message is sent through the connective tissue and whatnot. But at least it's in the door. And now things like Reiki, for example, which is just hands on or near the body doing something to the space in between that affects people. So I think it's a really, really big transformation that's happening now. And it's going to take a while for insurance companies to cover it and things like that. But I think it's the cat's out of the bag. And so I think energy medicine, this combination of the ancient and the modern, is really the wave of the future, if you will.
I co-teach a class with our colleague Len Wisniewski at the Georgetown School of Medicine. And it's a class on integrative medicine uh, titled The Western Practice of Eastern Medicine. And it's really encouraging to see the interest that young medical students have in these concepts. And that speaks to me to the sea change that's happened in the medical training community over the last 50 years, where I
Yeah,
think you and Len and your fellow travelers were really outliers back when you were in medical school.
no, it's true. Looking back on it, I don't know if it was courage on my part, or obliviousness of just, how extreme some of the views were. Even back then, talking about, I had just learned how to meditate before starting medical school. And I asked a few times, what impact would meditation have on this particular disease or syndrome? And the looks I got, I mean, really reflect the fact that there was no research on it back then, but now there's thousands of papers on it. So, people like Len and the American Holistic Medical Association, that was really important to at least have the people come together and realize that we're not alone and there's a great power in community and not just emotional support, but sharing knowledge and information. So, yeah, I think it's very different nowadays. That there is a lot of interest. That the young ones who are coming in a way, they don't have as much programming. I hate to say brainwashing, but it's kind of like that. That our whole culture has been directed in one particular way. And for example, took a few years off between college and medical school, and that made a big difference for me to see that there's other places around the world do things very, very differently. And there's good things and bad things about every approach. And so this integrative practice, as it's now being called, I think is really going to be quite powerful. And it's just the term integrative is I guess you would say a political compromise, because originally it was being called alternative medicine, but that means instead of, or other than. That organization I mentioned, holistic medicine, that's actually my favorite title because it gives the sense of there's a broad philosophy behind it. It was called complementary medicine for a while, which is a European British term that Americans didn't get. For example, our clinic, we were offering things like acupuncture and Reiki, and we called them complementary services. So we put out a newsletter about that. And we got people calling in saying, "Hi, I'm calling about the free therapies that you're offering," because, the words sound the same. But so integrative is a good compromise. It's the idea of coming together into a larger whole. I mean, there's the whole issue of assimilation versus, how literally do you want to take it? But I think it's just wonderful. So many medical schools have, even if it's just an elective or a few lectures on integrative approaches. I'm affiliated with Harvard, and they teach the medical students how to meditate. That to me is like, it's fabulous. So it really there are some advantages to having all this gray hair and being able to step back and see how things have changed.
Well, we're all indebted to you, pioneers in the field, who foolishly or wisely or both rushed forward and dragged the rest of us along with you. It's inconceivable to me that we would train medical professionals anywhere in the world today and not be talking to them about body and mind being two points of view on one thing. So when I'm talking to Georgetown students about integrative medicine, I say it's not taking one thing and putting it in something else. It's recognizing body is mind and mind is body. And we can parse those, and there are good reasons to parse that and look through one lens or the other. But at the beginning and end of the day, it's critically important to recognize we're looking at one thing.
Yeah, I mean, we are one organism, so we have many, many facets, and it's important to obviously to focus on the structural physical aspects of who we are. Um, this almost sounds like a confession, but I tore a ligament in my knee, and yes, I had surgery on it. I tried meditation and guided imagery for about 20 minutes and realized that was ridiculous. And yeah, so for that type of issue, it helps. But, for many people, they'll have an injury and they'll physically recover. But the mental part, the emotional part, the psychological part, the trauma of it stays with them. And that's one of the things that this whole mind body approach addresses. And, this was in the 70s. Hans Selye was the first scientist doctor who began to look at the connection between stress and physical health and illness. And it's obvious now, it's commonplace now, but back then it was very revolutionary to think that stress could have any effect on it. So all these sort of mind-body approaches, whether it's, meditation, guided imagery, psychotherapy is mind-body medicine, cognitive behavioral, psychodynamic, body-centered, whatever, they all are focusing on how those two realms interact. So
Mhm.
we're getting there.
I tell my new patients that cognitive therapy is energy medicine. Our thoughts are electrochemical activities and one of the organs of the body. So when we're working with thoughts, we're working with energy medicine. Of course, behavior too is energetic phenomena. So
Yeah.
I absolutely agree. Psychotherapy is energy medicine.
Yeah, and it's not usually thought about that way. Energy medicine still has a bit of a, you know, connotation of being a little bit weird or out there, but when you reframe it that way, every human interaction is a form of energy interaction, and that was one of the things I that got me interested in. I'm retired now, so I've had a chance to. I think you may have mentioned I had a chance to sit back and write a book about all these experiences, and that was a big part of it. Not just the clinical things that happen to patients when energy is invoked, but different kinds of human interactions that involve energy, and it could be, the doctor-patient relationship, but outside of medicine, human beings interact all the time, obviously. And some of the most powerful experiences we ever have in our life are as a result of interactions. It could be one-on-one, um, group phenomena, going to a concert or a baseball game or things like that. Those are very, very powerful experiences. And I think there's an energy field that is all of those have in common that I like to say that human beings are like tuning forks and that we can resonate. And, I'm sure everybody's had an opportunity to play with them, and it's quite wonderful that you can, have one here, and you bong this one, and this one starts to vibrate, and it seems like magic. Obviously, with tuning forks, there's the air transmits the sound waves, and we have a very solid physical explanation for it. But with some of these healing energy interactions, there's more than just electromagnetic fields involved, and that's why I think it's going to end up being the phrase that they use now is a paradigm shifter or paradigm buster that really will turn inside out the way we look at things.
Yeah. Last I counted, I think 25% of the neurons in our brain are mirror neurons. So
Really, I didn't.
clearly, nature decided it's really important that we resonate with each
Yeah,
other if we're going to
yeah,
live long and prosper.
that's a high number. I didn't realize it was that high. So yeah, that's another level of evidence for
Mhm.
this different viewpoint, right?
There's a word that's used in the culture. The word is phantom. And a lot of people will add after that at the opera and have ideas about phantoms. But phantom has a very particular meaning medically, and would love to hear a bit from you of your experience of this phenomenon of medical phantoms.
Yeah, yeah. No, that's really was an unexpected, I guess the term is rabbit hole for me to fall down in terms of coming to ways to coming to understand all this energy stuff. So just by way of background, I worked for most of my career in a pain management program in Boston, Spaulding Rehabilitation Hospital. And it was at the forefront because our goal was not to find the best medicine or the best nerve block to use. but to empower patients by teaching them ways that they can begin to manage their own pain. And some of it was exercise and stretching and time management and pacing, but a lot of it was stress management and mind body types of approaches. And it made a huge difference for a lot of people, especially when we began to add some of the energy based interventions, like acupuncture, for example. And there's it's not a version of acupuncture, but it's a cousin of acupuncture as a form of psychotherapy in which the patients tap on their own acupuncture points while they're mentally reviewing upsetting events. It's called, excuse me, it's called EFT or emotional freedom techniques or tapping, all under the umbrella of energy psychology. And very unusual things happen while people are doing it. It doesn't look like much. It actually looks kind of strange. But somehow or other, the tapping, the acupuncture meridian stimulation, allows people to just kind of release whatever it is that's associated with the trauma and feel better that way. So we were using approaches like that in our program, and it helped a lot of people, but not everybody. So one particular patient who really had a big impact on me suffered a syndrome that's unfortunately pretty common among people who've had amputations. Um, I'm sure many people have heard that you can have a limb missing and it still feels like the limb is there. So it's called a phantom because it is like ghostly. And it's very, very common after amputations to have that sensation. It's not quite as common, but still upwards of half amputees also have pain in that missing limb. And that particular pain syndrome didn't respond as well to our treatments as most of the other sort of more musculoskeletal types of pain. Now, the medical model was that the brain is kind of working overtime to fill in the gap left by the missing limb and the input that used to come from it, and it would create almost like a hallucination, create the illusion to maintain some sense of wholeness or stillness. But the treatments that come from that medical model don't really help, like painkillers and nerve blocks and anticonvulsants in the usual range didn't seem to work. So I had one particular patient. He was probably in his mid 30s. He had been working he was a forklift operator in a stockroom setting and had had an accident and it fell and crushed his leg. And he had to have what they call an above the knee amputation, um, which he adapted to. He got a prosthesis and learned to get around and all. But it really had an impact on him because he had been a very athletic guy. He was a hockey player, and a bit on the macho side, but it was pretty devastating to him. He didn't do all that well in our program. He tried everything. He applied himself well, but nothing really shifted. So one day, I don't want to say out of desperation, but so the next step was I said, Jim, let's try something different. Now for something completely different for you Monty Python fans out there. Not to be funny, but he laid down on the examining table and I said, just relax. I'm going to smooth things out for you. And what I did was just using my hands, I moved them through the space around him. The theory is that you're balancing out the electromagnetic field. And actually, since this is video, what viewers can demonstrate. If you just take your hands and put them a couple of feet apart and bring them closer and further without touching, and notice what sensations you detect. It actually helps to close your eyes so you can tune in more fully to these sensations. And people typically notice something when their hands are about a foot apart. And it's not the temperature sensation. Um, Many people describe it as a pressure or tingling. So, fair question. What is that? And there are whole schools of treatment based on that. That this is it's actually the boundary of your energy fields are bumping into each other, and that you can not only detect your field, you can find when, like, if I had a headache now, it would feel very tingly here, for example, compared to here where it's not. So that, for example, the treatment process known as therapeutic touch is based on this kind of assessment and smoothing out. It was very popular in the 80s and 90s, was sort of the first wave before Reiki, and I had learned that. So that was one of the modalities that I had used, and I asked this fellow if I could use it with him, and chronic pain patients, they're willing to try anything because they're miserable and nothing has worked so far. And also, our clinic had a little bit more of a green light because all the doctors would send us referrals saying, "Oh, we don't know what to do with them. You do whatever you want to do." So that really created a lot of opportunity for us. So, long story short, I did this same kind of assessment to Jim while he was lying down, and that same pressure or tingling that you might have felt, I felt, over his head and his shoulders and his torso. And then I'm still not really sure why. I kept doing that smoothing out over his missing leg. It was above the knee, so he had like a foot or so of thigh, but where the rest of his leg would have been, I kept doing that smoothing out thing. And I continued to feel that exact same pressure sensation, even though his limb obviously wasn't there. So that was number one on the weird things that happened. Number two was that he opened his eyes and said, "What are you doing, doc?" And I said, "What do you mean?" And he said he could feel me touching his phantom limb. Now, neither of those things should happen by the neurologic model because there aren't any nerves out there. In fact, my hands were a couple of feet away from the nearest physical tissue there. So it couldn't have been a power of suggestion because I didn't tell him what to do or what was going to happen. And in fact, I didn't know what was going to happen. So we were both very naive and open to the sensory experience. And what clicked for me right away was that I was feeling his energy field even where the body no longer existed. So a lot developed from that conceptually, but clinically it was interesting what happened because I said, well, let's just go with it and see what happens. And so as I continued to smooth it out, he described the sensation that the paint was like a liquid and it was flowing out the bottom of his foot through. It was like a valve in the sole of his foot. Um, he didn't know it, and I didn't know it at the time, but that was an important key acupuncture point that he was describing, the pain leaving. And I was thinking, oh, this is cool. This is going to be one of those miracle cures that everybody talks about. But then he said, "That's enough, doc. Let's just stop." And I said, "What do you mean? It's working. We're doing what we hope to do." And he was saying it just felt too weird to have the pain move around like that. So, I took my direction from the patient and I stopped and we talked about it a little bit. But he did not want to complete the healing process. He couldn't really put his finger on why that was, but I got more of a sense of it over the next few sessions. He came a few more times and then he actually left the program and moved out of state. So I've lost touch with him. But what I came to believe based on what he was telling me was that if the pain completely left his leg, he would have no sensation from that leg at all. And he would really, truly, for the first time, feel as though he was missing a leg. In other words, the pain served a psychological function. Even though it was unpleasant, it at least allowed him to maintain the image that he was intact. Obviously, if he opened his eyes and looked, then there was no leg there. But psychologically, internally, it was really important for him to maintain that sense of wholeness and integrity. So, that's a whole psychotherapy domain right there, is how to come to terms with bodily integrity and who am I and what was the sense of loss from having that injury and all those things. He wasn't in that frame of mind to do that work, and what I came to realize was it wasn't my job to push him into something he didn't want to do. So I respected that and allowed him to go his way. So that for me was like the third major learn. This session lasted maybe a half hour, and it was like, I don't even know, like 30 years ago or something, and it's still kind of the implications of it are unfolding. So I'm really grateful to Jim wherever you are. I hope you're feeling well. But wow, it just opened my eyes to so many different things. So that was quite wonderful, quite amazing.
Thanks for sharing that experience with us. It does seem to be at the core of an agenda that gets set between a provider and a patient. As I was listening to you, I was remembering a couple that came to me years ago and asked for help. And I said, well, what would you want help with? And they said, well, whenever we start talking to each other, we end up in an argument. So I said, well, let me see how that works. Just, talk to each other for a minute and let's see where that goes. And sure enough, they started talking about one of their children. And, within 2 minutes, they were going around like cats in a sack. And I didn't want them to practice more of that. So I said, okay, I think I got it. And let's pause there. And I taught them a couple of very basic listening skills that would redirect the interaction from arguments and fights with each other to actual communication. And they went, oh, this is cool. Yeah, I said, well, why don't you go home and for homework, just take 5 minutes a day and practice just this one tool, and then come back next week and let me know what happens. So they said, okay. And they did. They went home and they did their homework and they came back and I said, so did you do your homework? And they said, oh, yeah, we did. And I said, well, what happened? And they said, oh, well, we argued the whole time. And then a little light bulb went on in my brain. And I gave them each a piece of paper. And I said, I'd like you to write arguing at the top and draw a line down the center. And on the left side, I'd like you to write down all of the benefits of arguing. And on the right side, the price you pay to get the benefits.
Yeah.
They said, oh, okay. So they each worked on their papers. And I said, now I want you to write a number at the bottom of each column. The numbers will equal 10 and they'll weigh the appeal of the benefits against the aversiveness of the cost. So they did. I said, okay, hand me your papers. I looked at them and they were like mirror images. And both of them said the benefits were 80% attractive to them. The cost was only 20%. So I showed them what the other person had written. And then I said, John and Mary, it seems to me that you guys have what you want when it comes to how you're talking to each other. And they looked at each other and they kind of laughed and they said, yeah, I think we do. And I said, well, is anything you'd want help changing? Anything else? And they said, no, not really. I said, okay, well, I guess we're done. And they left. And it was a moment like your moment for me to realize my idea of a best outcome from an intervention is my idea. And it's a really good idea for us very early on and often, I believe, to check what's going on in terms of the patient's perception of a best outcome.
Yeah, no, that's a good example. I mean, I'm sure there are a lot of these couples around that at some level do enjoy arguing. It's very activating and intense. And as long as they don't come to blows, then that can be that's one way of doing it. It's not for everybody, but you recognize that was their way and you're okay with it. And so yeah, it's a very, very parallel kind of thing that doctors don't always know what's best.
And my guess is, I see this a lot when I'm training other clinicians, that doctors get invested in having their way with patients. So when you were describing the interaction with Jim and the pain starting to go down, you had that thought, oh, cool. This is going to be a miracle cure moment. This is great. And to your credit, when Jim started to push back, you were willing to let go of that. But what I see a lot of clinicians get into is a kind of power struggle with patients. and the clinician needing the patient to get on board with the clinician's idea of a best outcome. And if that's not happening, the clinician will start labeling the patient treatment resistant or
Right.
something like that.
Well, you're getting into dangerous territory here because you're suggesting that doctors are not gods. And
I'm
yeah,
sorry. I'm sorry. I didn't mean it.
I know. I was just, we were never told that explicitly, but it's the feeling that you get that when in doubt, the doctor knows the answer. And so we're at the top of the pyramid and all of that. And the power issues are definitely there. That was one of the really wonderful things about working in the rehabilitation setting is that their model is collaborative and team involved. And the doctor knows certain things that the physical therapist doesn't know. Physical therapist knows things that the occupational therapist doesn't know, and the nurse, and you have to put it all together to make it work. So it's by nature much less hierarchical than traditional specialty oriented medicine. And then with pain management, yeah, I think it really has to go that way. In fact, the direction that integrative medicine is taking now, or integrative health, as it's being called, is whole person health, WHOLE, whole person health. That these are all different but important ingredients, and the doctor is not the source of health. It's much more like a coach. The doctor is more like a coach than the omnipotent, omniscient authority figure. And, honestly, some people are attracted to medicine because of the power issues. Not, I wouldn't say a majority or anything like that, but there is that undercurrent. But again, I think that's changing a lot now that we're realizing that the patient empowerment, I think, is the way to go. That my view, and many people's view, is that healing comes from within. It's not a pill or an X-ray beam or something like that. That's the source of it. That those things can help activate what's inside, and a doctor can help activate what's inside. Some people do respond to authority figures and prefer to work with an authority figure who tells them what to do. And that's fair enough. And it's nice if a clinician can adapt and, sort of suss out where their patients are at. And some people like more directive styles. Some people like indirect styles. And some people like to be empowered by, here, try this and see what happens. And you seem like you have a knack for this. Let's see what happens if you practice it more. Things like that. And I think that's, it's the way to go. It's not how hospitals are set up. Our whole system is set up with a whole different model of, bottom line, dispensing pills is the, don't get me started on. I'm sorry. I got myself started on it. No, but I think psychiatry always was like poor relation among the medical specialties. And we always felt a little bit inferior because we weren't as concrete and tangible. So I think this whole trend with psychopharmacology over the last 30 or 40 years is partly our inferiority complex, if you want to put it like that. Obviously a lot of good comes from medication in the short term, but not as long-term solution. So I think the pendulum for psychiatry hopefully is swinging back more towards its roots as a more concrete form of psychotherapy, with the mind-body connection being the cornerstone of it.
Mhm. I know that you have looked at energy in the relational field between patients and providers, and would love to hear a bit about what you have learned in that direction.
Be glad to. I just realized there's one other aspect of phantom pain that I wanted to mention because it's quite cool. I mean, it's one thing for me to say, "Oh, yes, I could feel something," but a skeptic will say, "Oh, he's just, that's what he wants to believe," and power suggestion, things like that. Many other clinicians have felt similar things. Some people who are very sensitive visually can actually see an energy field and see a phantom limb. Some people have treated phantom limb pain by uh, treating the acupuncture point of the phantom limb. So it looks like they're just holding their fingers in empty space, but they get the same effect I do. So it would be nice if there was a more, mechanical or device that could measure or detect or create an image of a phantom limb. So I have a couple of book covers here because they illustrate the point that a while ago there was a form of photography called Kirlian photography, which could detect the electrical field around living objects. And because of the way that photographic plates were set up, it worked best with flat objects like leaves. So this is a picture from a cover of one of the first integrative medicine books, holistic medicine books, and that's a leaf, and it shows the curlian field around the leaf. So the question that some researchers wondered, what would happen if you cut off the bottom part of that leaf? Most people assume that the corona would just follow the boundary of the leaf. Well, that wasn't the case, and this is the cover of another book. The leaf is oriented differently, but this is what the corona is still there, even though the leaf is gone. So this is a exact total analog to what I experienced with that phantom limb. That the field is not created by the body, and it's like a light bulb glowing, and you can see it out there. It somehow exists independently from the arm, from the leaf tip, from what have you. So that forces the idea that the field comes first. And again, the common image that really I think covers it is the you probably did this in seventh grade or whatever with take a sheet of paper and put a bar magnet under it and sprinkle iron filings on top of it. The iron filings line up in this really beautiful geometric shape that you didn't see anything there with your, visibly to the eye, but those lines of force were there. The filings lined up in alignment with the lines of force that were invisible. So I think it's an exact analog with the cells in your body are like iron filings that line up with these invisible force lines of the biofield, as it's called. And it can be acupuncture meridians or the energy centers that they talk about. So the biofield comes first, and the physical structure almost like it precipitates around it, condenses around it. So with a phantom limb, you're sweeping away the iron filings of that leg, but the magnetic field is still there. So that's an area that there hasn't been a good way to replicate those early images of the phantom leaf, and there hasn't been a good image yet of a phantom limb or a finger or anything. But I think I'm working with a team of you know engineers and biophysicists and people like that who understand gizmos way more than I do. But that would be a wonderful way to corroborate this whole biofield model with phantom limbs and health in general. So that's a whole other direction that I'm really intrigued to see where it goes. But to get back to your original question, which I
Let
have not.
me add to what you had just said there. Richard Davidson out at the University of Wisconsin-Madison was giving a talk a while back at a conference, and he was talking about some early research he did with John Kabat-Zinn on mindfulness-based stress reduction, where they would teach patients these techniques. And part of the research design was correlating the amount of time the patients spent doing homework with the improvement that they experienced physically and emotionally. And they were thinking, well, people who do more of it, they're going to get more better than others. And the data didn't show that at all. So Davidson needed to scratch his head a bit. One of those wonderful moments in research where we think we're going to show something and then we show something else. So someone asked him, well, what was going on there? What was the active ingredient? And he said, I think it was time with John, that hanging out with John Kabat-Zinn helped people feel better. And it wasn't what they were doing at home, it was what they were doing in the groups that he was in that was shifting the energy for them and producing a different experience of themselves physically and emotionally. So I hadn't thought of it in that dimension, but we could understand that as a form of energy healing as well, being in the
Yeah.
presence of someone who's living in alignment and projecting that energy into the relational field.
Yeah, no, that's a great example. And I don't want to speak for them, but I don't think either John or Richie believes in biofields and makes that the focus of their work. And yet, that's that's a perfect example of what the biofield model would experience. And, in my book, I talk about personal experiences with people who have very highly developed energy fields, and you can feel it. The word charisma, I think, is another word for somebody who has a big electromagnetic field. And there are ways to measure, magnetic measurements, but you don't go around with a magnetometer trailing after these Hollywood stars to see who has the biggest aura. Although that would be interesting to do something like that now that I think of it. But yeah, in interpersonal interactions, there's something in the space between people. It's not an empty space. And I guess the most convenient way to think of it is that there's some kind of magnetic field that the physical magnet may have this shape, but the lines of force go out around it. And it's the same with human beings. Many people have researched it from different directions. The way that I ended up pursuing it was an outgrowth of my interest in sports. Not as an athlete, I'm not a particularly good athlete, but a fan. I was a very good fan. And our quick digression, in the Boston area, our baseball team for many, many years, up until 2004, was terrible. And then a lot of things came together. We won the World Series. It was very magical. And there were all sorts of really interesting group energy interactions happening, not just the team chemistry within the players, the way the fans interacted with the players. And I got very interested in that, and fortunately had a cousin who was a filmmaker. So we ended up putting together a documentary film about the Red Sox and how the positive emotions played a role in their success and their interactions and their success. We called it The Joy of Sox, which, yeah, it turns out people of a certain age are the ones who get that pun, and the younger folks never heard of that. The book, The Joy of Sex, for those who don't know. But we had a lot of cooperation from the team in filming, interviewing players, and I got to interview some of the researchers on biofields too. And the film is now it's available for free on YouTube. People can go to the website for my book. The website is called www.themysteryoflifeenergy, and then just go to the resources tab, and it's the first thing that comes on. You can just watch it. It's a 60-minute thing. It was on PBS, and it was really fun to do. But the piece of it that relates to what you're talking about was an experiment, or not experiment, a demonstration that we did with people at the HeartMath Institute. Roland McCready and his team have developed some very simple meditation techniques focused on the heart area and the positive emotions like appreciation. And what they found was that just by thinking about and feeling that particular emotion and breathing in and out as though it's coming from your heart can cause a complete shift in your heart rate rhythms. The heart doesn't beat like a metronome. It's not like boop, 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 boop. The interval between beats actually changes in a certain pattern depending on whether you're anxious or whether you're relaxed. And they have found very simple ways to measure and monitor these changes depending on whether you're in a state of appreciation or not. So what I wondered and what we tested out was if there really are magnetic fields around each other and a group of people are in that coherent state, as they call it heart coherence, does that have an impact on other people who are nearby? So we did an experiment where I was the guinea pig because I did not know this heart coherence meditation technique. I sat down in their psychophysiology lab, and they hooked me up to a heart rate monitor can't remember now whether it was my finger or earlobe, but just by measuring that, they could track my level of heart coherence, and I did not have much at all. And then to make it an experiment, I had headphones on, so I couldn't hear anything. I had my eyes were covered, so I was in sensory isolation and didn't know what was going on in the room. And at some point, Roland signaled for these meditators to come in, and four heart math practitioners sat around me. You know, they were 2 or 3 feet away, but I didn't know they were there. I didn't know what they were doing, and he gave them the signal to start their heart meditation. And the question would be, what effect, if any, would it have on my heart rhythms that were being continuously monitored throughout this process? And it was this maybe not strange, it was very dramatic that within 5 or 10 seconds of them getting the signal to start meditating, my heart rhythm shifted into this coherence mode that was very, very um, visible and palpable. And it's, you know, there's a vignette in the documentary that shows that. And so it was important on several levels, not just that emotions are contagious and that you can feel your system can be impacted by emotions, even if you're not consciously knowing what's going on. The interesting thing was I did feel something shift in the room. It was like very, it wasn't like happiness. I wouldn't say it was that, but there was a lightness that I began to feel. Couldn't put my finger on it, but my nervous system obviously felt it and was affected by it, and it registered. So that to me showed that, you know, we were all resonating like tuning forks on the same note of appreciation. And that was a good model, I thought, for team chemistry when the players appreciate each other and love each other, if you want to use that word. And that helps them perform better. As Dr. McCready mentioned, that some of the studies they've done, when people are in a state of heart coherence, their reflexes improve, their mind-body coordination improves, and the comparison he gave in the movie in the interview was that if you're a baseball player and you're batting, um, the pitcher may be pitching it at 90 miles an hour, but it seems slower to you. It seems like 80 miles an hour, and it gives you that added advantage to be able to make a hit. So there's, you know, the outcome in the physical level is very helpful for athletics, and there's a whole new development of sports psychology using these approaches too. But for the purposes of what we're talking about, it was a really vivid way of showing that human beings interact through these invisible forces that we may not consciously know about, but there are ways of detecting it through machines and tuning into to feel it within your own body mind system.
I have been studying Zen for 50 years, actually, my whole life. Before I knew what Zen was, I was sitting. So seems to have been part of my karma to come into this lifetime and practice presence. And some years back, I realized I wanted to sit with each patient for a minute before we started our session.
Mm.
So all of my work now and much of my teaching is telemedicine. But before I enter the meeting, I'll sit and then I'll bow to this being that I'm about to encounter. And then we'll start the session. And this feels that I have a responsibility to my patients to do this, to tune in, we could say, before I show up as the healer in the room. And patients give me feedback at the end of every session, and they have an opportunity to fill out a brief form, tell me what they liked, what they didn't. And the most consistent thing I see written about what they liked is your presence.
Mm. Wow.
They don't say, oh, you have very clever methods, or,
Right.
right? It's not
Right.
like something I do. What they respond to, and you know, as good a data as we're going to get, I think, is you're there.
Yeah. Well, again, that's a great example. And you don't even have to use biofield language that they know what it is when someone's present. And it's not a common experience in everyday life. People are so distracted these days. I mean, you can be sitting with someone physically and they're not present
Yeah.
because their mind is going off on 23 other different things. And that sense of connection with someone who's present is a really powerful healer. So, yeah, all those years of training in cognitive behavioral therapy, you don't need that. You just need to be able to
I
check the
remember once going to a talk in Portland, Oregon. The Dalai Lama was in town. Um, and as a sidebar, there's interesting studies. I think you might have done some of them. What happens when the Dalai Lama comes to town, or when there's a intentional community that comes together to meditate for a period of time. But I was sitting in a room with, probably 500 of my closest friends. And at one point, I just looked around at people in the room, and then I looked at the Dalai Lama. It was different. And it was different in exactly that dimension that you're pointing to. People in the room were, doing stuff. The Dalai Lama, it was like, a gong sounding bong. The next second, bong. It was
yeah,
just there.
yeah, yeah,
And I was struck by that, and also realized that's part of the influence that he exerts uh, in the world community. It's not what he says or does. No, it's just that bong.
yeah. No, right. Because I mean that goes back to the tuning fork metaphor that, we each have the ability to resonate at that level, even though we may not live it in our everyday life or may not even know that it exists. But when we're with somebody who has that, it kind of emerges. It's always been there. It's always already there, but this is the way that it shows its presence, shows its face. So yeah, people like him are just have a huge influence, and you can see how many people around the world respect and admire and love him for his ability to do that. And he says it's not nothing special that everybody can do it. It takes a little practice, and
Yeah.
sometimes 50 years and this isn't enough. You need to come back 3 or 4 more times to get the hang of it.
Well, Rick, I feel so blessed to have you as a fellow traveler on the road of healing. Grateful for your book. I'm going to put a link to the book website here at the end of our chat. I feel better as a result of having had the opportunity to hang out with you here this morning. Anything you'd like to say by way of closing?
No, I think one thing I've learned in this whole process of writing about it and talking about it is that d- I talked about athletes, and there's that expression of being in the zone for peak performance when they're in the flow state and everything clicks. As I said, I'm not a good athlete, but for me, the flow state is when I'm talking about stuff like this. For everybody has their own different form for having being in the zone, and that's part of the fun of life is to figure out what, whether it's gardening or doing crafts or playing with kids or whatever. So there's an energy component to that, but I just would urge people to, follow their instincts on that. And just one other point, I guess it's a little bit of a plug, but I do uh, do blog posts every few weeks, and if people want to check into that, they on the website you just click under blog, and you can sign up for notices. I just wrote one because there's with the mainstream institutions are not so flexible all the time about new therapies. So American Psychological Association has put up a lot of resistance about these tapping therapies. There was just a recent article in the New York Times that was trying to debunk it, but it was so unprofessionally written that I and many others have commented on it. So, for the sort of the politics and the behind the scenes pushing and shoving, the latest blog post was about that. But just want to mention that. So yeah. But no, also it is always fun to connect up with people who've done in parallel something similar and sharing those experiences. So appreciate the opportunity to connect with you here.
I too would give Rick's site and work a plug. He also has a wonderful resources tab that has a whole bunch of stuff on it that I've really enjoyed taking a look at. Would very much recommend his book. Um, I think it's a wise book. It's probably also a smart book, but I'm not smart enough to know that it's smart. But I'm dumb enough to know that it's wise. And it's wonderful to have a wisdom figure in our community whose idea of flow is talking to us about the experience of human wisdom. So thank you, Rick, for your time, your life, and your work.
Well, thank you. I appreciate those very kind words, and I would reflect them back to you. I feel very similarly to you in your work. So thanks again for having me as a guest on your show.